Now that I've properly administered my medication into the cup, I'm going to bring it into the patient's room. And I'm going to wash my hands first. Okay, now I would introduce myself. Hi.
Hi.
My name is LaBelle. I'm a student nurse. Could you tell me your first and last name?
Miles Larson,
Okay, and what's your birthday?
7/12/82.
Okay, thank you. Very good. I'm just going to provide privacy by pulling the curtain or shutting the door. Today I'm going to be giving you your digoxin medication. It's for your atrial fibrillation. It regulates your heartbeat. So first I'm going to have to listen to your apical pulse just to get a baseline for what your heart sounds like right now. And get your heart rate. Okay. I'm going to listen to it for a full minute. Heart rate is 69. Now that I've listened to his apical pulse and got a baseline for after I give the medication, I would just check to make sure I have the medication right and I have the right patient and I have the right dose again. So I have digoxin and it's 0.125 milligrams. It's a tablet, so it's by mouth, and it's about 5 p.m. right now, so it's the right time. And I have Miles here, who's my right patient. So then I would just ask him, do you have any questions about your medication? No? Okay, so you take it pretty regularly, so you probably know about some of the common side effects. Some common side effects are vision changes, dizziness, drowsiness, maybe a rash. If any of those things happen, don't be alarmed, but you can always use your call bell to call me if you have any questions or if any of those things happen for any reason. Now that I've done my assessment and I've checked again that I have the right medication, I'm going to give him his medication to take it. And he's okay swallowing it. Okay, thank you very much. He did take the medication. Now, before I leave, I would just ask him, do you have any other questions? Are you comfortable? Do you need anything else while I'm in here? No? Okay, so your call bell's right here, as you know. If you need anything, I'll be back in 20 minutes. If you need anything between that time, just use your call bell. But I'll be back in 20 minutes to check on you. So I would take all my supplies and then wash my hands before I left the room. After I left the room, I would immediately want to document what I just did, just so I didn't forget anything. I would have his medication administration record, and I would go under the part that says digoxin, make sure it was the right drug, right amount, right dose, right dose, right route, right time, and the right patient's MAR that I had, and I would write down the date that I gave it to him, which was 10/5/13 at 5 p.m. or 1700 if you're doing military time, and my initials. Just so whoever was looking at this could know that I did in fact give it to him at that time. After I documented everything and put it in the chart, I would go back in the room in 20 minutes and check his apical pulse again, listen to his heart sounds, just so I could compare it to my baseline that I got earlier, so I could see if the medication was having the correct response, and just see if he's okay. And that's medication administration. Thank you.